Hi, my name is Jane Lualbaran and today I'll be discussing the machine learning and robotics in medicine. So let's get started. Machine learning and robotics in medicine refers to the integration of AI-driven algorithms and advanced to enhance diagnose, treatment, and patient care. Machine learning analyze medical data for productive insight, while robotics provide high of assistance in surgery, rehabilitation, and logistic, ultimately for improved patient outcomes and increased efficiency. The healthcare sector has not only counted on technology within its sector to enhance patient care, the effectiveness of diagnosing patients, as well as providing patient intervention for a patient. Over the few years, however, two technological advancements have started changing the landscape of medicine, as well know it machine learning and robotics. These two new technologies provide healthcare organization and with the diagnosed patient faster, perform surgical operation more precisely, and manage their organization more efficiently. So, machine learning can be defined as a subfield of artificial intelligence which helps computer learn from experience to identify part and data. Robotics, on the other hand, is the use of machines that perform this designated tasks automatically or within limited human oversight. This technology, when utilized with the practice of medicine, serve to help healthcare improve patient care by producing better treatment results. So here is a question. What is it? Machine learning in healthcare includes all types of algorithms used to help analyze a large volume of data pertaining to the healthcare service. Machine learning can analyze and defining trends, predicting results, and supporting clinical decision making. For example, machine learning applications are able to analyze thousands of X-rays or MRI image in order to learn about the abnormalities, such as a tumor, that they were designed to find. As time passes by, they gather more information produced via the use of additional data points. They are also tend to develop gather accuracy. So in this part, I'll be summarized. So medical robots includes robotic systems that help therapists perform, and this robot can help with surgical procedures, rehabilitation, and logistic, as well as monitoring patients. So next, when robotics and machine learning come together, and intelligent healthcare system is created. The brain of this intelligent health system consists of the machine learning components, which are responsible for analyzing data and making prediction based on that data. The robotics body of this intelligent health system is responsible for completing physical tasks in hospitals and operation rooms. Next is many technologies are being utilized for numerous medical applications. One is medical image analysis. Algorithms work with machine learning to analyze scans of various types of medical image to help identify potential disease early compared to using traditional techniques. The second is robotic surgery. Robotic system surgeons in performing delicate surgery while providing increase and control during the procedure. Rehabilitation robotics is robot will assist patient in movement after suffering from a physical injury or stroke by providing a control environment to inform physically therapy exercise. Next is hospital service robotics. Robotics will deliver medication, clean surgical room, and transport or materials within the hospital. Productive healthcare using a source of machine learning technologies or techniques can be used to create productive model for determining if a patient has a risk of experience a serious medication condition. So let's go to the next. So in this illustration, through the advancements of technology in contemporary healthcare, technologies that have had a impact on transformation of the practice of modern medical treatment include both machine learning and robotics. Machine learning analyzes large amount of the medical data, identify parts of that can help to identify disease. And robotics allow to perform physical tasks in areas such as surgery, rehabilitation therapy, and hospital operation. When combined the machine learning and robotics, they allow to the creation of intelligent healthcare delivery system, leading to improved diagnosis and treatment and patient care. Next is why we use it. High volume of data are generated every day by the health of care system. The use of machine learning technologies or robotics is becoming an important tool to dealing with the data involving in the delivery of healthcare. Why use it in machine learning and robotics in medicine? The first is improved diagnosis accuracy. System. This is the first one, and the second is faster medical analysis, rapid processing of complex datasets for quicker decision. Next is precision in surgery. Robotic system enable to delicate high accuracy movements. Next is reduce human error. Support tools minimize potential mistakes. Next is improve patient monitoring, continuous and taking early warning sign. Next is efficiency in hospital. Robots handling logistic like free staff direct patient care. The next is the second diagram. So this diagram show machine learning help doctor analyze medical data and support medical decision. The first is start with patient medical data. This includes information such as X-ray, MRI, scan, laboratory result, and patient medical records. This data source provide important information about the patient health condition. And the second is data get through data processing. In this step, the medical data is organized and cleaned so that the computer system and can understand it properly. So, this may include moving errors, converting image into digital data and preparing the information for analysis. Next is the data and analyzed by a machine learning algorithm. The algorithm is trained use large data sets of previous medical case. In it learns pattern from this example, so it can record sign of disease in new patient data. After that, the system performed pattern recognition. The machine learning model identifies patterns or abnormalities in the data. Why not use it? Increase experience because robotic system and AI technology are also costly. Hospital will like incur additional financial experience. Loss of personal privacy. Patient medical robots must still are productive against and other threats on their personal. Next is limited human judgment. Technology has limitation and use unable to replace the mental and emotional experience and there are ability to express good in patient care. Next is ethical challenges. The question remains as to how it able to eligible for any errors made by an AI system. Technological restriction maybe it's depends on there being amount of high quality medical data which the essential of proper operation of the system. So the next is the third diagram. So in this diagram, although machine learning and robotics provide many benefits in medicine, there are also some reasons why are not allowed used. The first is technology is very expensive, so not all hospital can afford it. The second is machine learning system requires large amount of patient data, which concerns about privacy and security. The third is machine cannot place human judgment, experience, and empathy. The doctors must still make the final decision. And there are also ethical issues such as how is responsible if an AI system make it mistake. These technologies have technical limitation because they depend on high quality data and required skilled professionalists and maintain them. Next is the three advantages and disadvantages. The advantages is improve accuracy in diagnosing illness. Artificial intelligence can help analyze informs such as X-ray, image, MRIs, and patient records to help identify disease sooner and with greater accuracy and traditional methods of diagnose. Improved surgical. The robotics will allow surgeons to operate with the increase, reducing and risk of human error, creating similar, resulting in reduced pain and allowing patients to recover more rapidly. The third is rapid data analysis. Machine learning allows medical professionals to access large volume of data quickly, allowing for faster and better treatment decision. So next is the disadvantage. High cost is the experience of using a medical robot or a system that use machine learning is very high because hospital must invest in requirement, software and training. The second is data privacy and security risk. Machine learning requires large amount of patient data. If this data is not protected properly, it can be hacked or another thing. Depending on technology, there is a possible that may become over on machine-based process make it will be essential to access how defending may become on using the machine in the event of incorrect prediction. Next is machine learning in medical diagnose flow from data collection to treatment decision. The first is data collection process, gathering and preparing patient medical data for analysis. Next is machine learning algorithm analysis. AI identifies pattern in the data for potential diagnosis. The next is the doctor evaluation, physical review, AI prediction and insight. Next is treatment decision, make informed choose for patient care. Next is robotic and surgery flow. Preparing step up reading patient and robotic system for the surgical procedure. Next is surgeon guided operation. Surgeon control robots arms are mainly like action. Monitoring and advancement. Continuous oversight and real time during the surgery. Completion of recovery. Analyze that produce and initial patient healing. So, AI robotics and patient interaction. This diagram illustrates the collaborative relationship within modern healthcare. Patient medical data fades into machine learning for analysis, informing doctors, and robotic assistants can be employed for treatments or converging to improve patient outcome. The future of the medicine is machine learning and robotics are transform medical, enhance diagnosis, surgical, and hospital efficiency. Key advantage is include improved diagnostic accuracy during human error. Patient healthcare and stand. Significant challenges such as high cost data privacy and ethical concern must be careful addresses. The future of health improve responsible ethical integration of this technology with human medical expertise remain central. Hope you like my video. Thank you for watching. Bye.